Greetings to the class of 2020. My name is Esther Choo. I'm an associate professor in the Department of Emergency Medicine, and I'm so honored to celebrate here with you today. You may not realize when you extended this invitation to me that I came to OHSU as faculty in 2016, the same year that you did, and so I feel like I've traveled this four-year journey with you, and it has been particularly special for me to be able to come here today and speak to you. We all have specific expectations, don't we, for the defining moments in our lives, from birth to death. Ritual and ceremony, pomp and circumstance seem to mark these moments and grant them significance. Processes need a culmination. There's no single day that made you a physician, and yet the totality of day after day, night after night, test after test, lecture after lecture, and clinic and ward days, and evenings and nights somehow added up to you arriving here today, ready to be a physician. It's both a puzzle and a truth that no one day in your education really mattered, and yet all of them together, the sum total of them, did matter. And that's what we're recognizing with these moments. And these moments are truly special to us, a socially ingrained habit that is very difficult to let go of. My brother and his partner decided at one point not to get married. And I was completely cool with that. I just want to be clear. I adore her, and I started calling her my sister outlaw because she was truly a sister to me in every way, except for the ceremony and the piece of paper. And yet, when they changed their minds recently and announced that they were getting married, that they were going to have that celebration, I surprised myself by crying with joy. And it wasn't the legal aspects or the formalization, it was the chance to celebrate them and recognize their commitment to and their journey with each other. In the same way, I'm so happy to officially celebrate with you the commitment and tremendous journey that you have gone on to arrive where you are today. But it's an odd way to celebrate, isn't it? And what difference should that make? On the one hand, there's nothing special at all about graduating in a pandemic. No matter what, you have gone through the same educational process that we deemed the requirement to proceed along the path to becoming a physician. One celebration does not confer this degree or validate your accomplishments, and thus the loss of one in-person graduating ceremony does not take it away. You will move on with your careers just like the other million physicians currently practicing in the US. While your medical school years provided a foundation of learning, your practice will be shaped mostly by the upcoming years of your residency, which will be a more intense learning period than any of the years that have come before. There's nothing about a digital ceremony in itself that takes away from your futures. On the other hand, graduating in a pandemic does signify something, doesn't it? You were graduating in the midst of a largely preventable public health tragedy, one that has stimulated a recession in a time when we have already seen the escalation of man-made natural disasters, the broadening of societal gaps that have deepened health inequities, and the critical absence of safety nets. As medical students embedded in clinics or perhaps in the emergency room with me, you saw the large people-sized cracks in our healthcare system. But now they can be seen by everyone. Major healthcare reform is on the table, and the pandemic will force us to look at the political and economic and societal drivers of our tremendously burdensome health system, and hopefully decide once and for all that the stress placed on everyday Americans so they can have access to basic healthcare is not acceptable. Perhaps your careers, born in this pandemic, will be a forever reminder of the recipe that created the crisis that led us to being indoors instead of out of doors, celebrating today. Because of COVID-19, you will understand, like no other generation, how poverty, unemployment, lack of health insurance, incarceration, and lack of stable housing are virtual death traps in times of crisis. You understand that inequities based on race and ethnicity are built into our current system, carved into it, and deepen when a system is under stress. I actually envy you this early understanding because it took me a while to get there, and my work on these fronts is relegated to my shrinking remaining time in medicine. I hope you use your given time more wisely. You will all understand forced isolation from this pandemic, having experienced it to some degree yourselves, And now perhaps you will be more aware of those who are always isolated due to age, disability, or other factors. You will have more compassion for them. You will always understand how deeply they, too, need connection and care. This pandemic has been a showcase for public health and science. If you ever needed application of the concepts learned in the classroom, COVID-19 has presented it. The healthcare community sounded the alarm about staying at home, flattening the curve, containing the disease, and expanding our healthcare capacity as rapidly as possible. We have leapt into action, putting epidemiology, public health, evidence-based science, and emergency and disaster response into practice at a pace that at times has made real life feel like a summer blockbuster. I hope that no matter what your exact chosen career course, each of you continues to advance your knowledge and expertise in these areas. No matter how strong of a believer you were to begin with, I trust that none of you will ever question again the importance of the voice of healthcare and public health professionals in advocacy and in leadership. Many of you now see the absolute necessity of entering public service, or at least of ardently supporting the candidacies of healthcare professionals running for office, so that we can lead in times of crisis, not simply follow with warnings and admonitions. In this time, we were driven to shift your education online, and we shifted much of our healthcare as well to technology-based platforms. I think we will never fully return to traditional care models, appreciating the reach and convenience afforded to our communities. I hope moving forward we will stop hesitating about ways in which we can turn healthcare inside out and stop requiring patients to meet us in our places, on our schedule, and our terms. At the same time, we must also recognize how telehealth still leaves out many without access to what we consider basic technologies, and look for opportunities to further narrow that gap. Many of you who were taken out of the classrooms and off the wards pivoted immediately and participated in work such as finding childcare for frontline healthcare workers, diving into your clinical work early in some cases, and contributing to our mission through research and advocacy. These actions were so remarkable, and they were characteristic of what I know of you personally. And I hope you felt the power of your humble, generous, creative, and community-minded actions. I know I did. I would have loved to be with you today, physically with you. I would love to have met your families and celebrated with you in person. But I hope the relative isolation of the pandemic puts an indelible mark on each of you, something that binds every member of your graduating class here at OHSU with every graduating class in every health professional school across the country and around the world. I hope the memory of this day, what it was not, and why, imbues your entire generation with purpose and determination. We will get through this crisis. And when the next global health crisis comes, as it surely will within your career, we will say about you, they were the class that trained during the pandemic of 2020. They were forged in the fire of a public health catastrophe. They were made to lead in this moment. Congratulations to the Oregon Health and Science School of Medicine class of 2020. I truly look forward to witnessing your work across the great state of Oregon and in the world.